Hello, Dr. Lisa Brandy here. Today we're going to talk about the diabetic foot. The diabetic foot is a very complicated subject. We will just touch on the surface here and give you just the main reasons why a person with a diabetes is usually recommended to see a foot doctor regularly. The main two reasons are diabetic nerve damage, called diabetic neuropathy, and also poor circulation. When a person has diabetes, it affects the nerve endings in the feet as well as the arteries and the blood flow in the feet. This can be detected early if they are visiting a podiatrist regularly because they will get those items checked annually, and then it can be detected and symptoms minimized. What is diabetic neuropathy? Diabetic neuropathy is when a patient who has diabetes will come in and will touch the bottom of their feet and they don't feel it. So it's nerve damage to the point where you can't feel touch, you can't feel temperature. Sometimes you will have an open wound, you'll have calluses and not even know it. What does poor circulation in the diabetic foot look like? Many times people will have red or really tight skin. The skin will be very dry. They'll walk a few steps and get cramps, burning in their feet. Many of these are symptoms of poor circulation. Treatment for a diabetic foot is very complicated and diverse as well. For the diabetic neuropathy, we work together along with their neurologist, along with their endocrinologist, and their primary care doctor. To have treatment for the poor circulation, we also work with their vascular specialist. We ask the patients to always purchase a very large toe box, wide fitting shoe so that the foot has room to expand when they're walking during the day. We also ask the diabetic to always check their shoes regularly in the morning. Why? Because a lot of times you'll have your shoes on the floor. Something could have dropped overnight in the shoe. Something like a thumbtack, a button, a pin, whatever. A foreign object could have dropped in the shoe and you will just put the shoe on, and because you have neuropathy or poor circulation, you won't detect it. Moisturizing the feet is also a treatment that a person can do at home to make sure that their diabetic foot is very healthy. Moisturize from the outside, never in between the toes. Many treatments, symptoms, factors involved with the diabetic foot. Very complicated and diverse subject. So if you are a diabetic, you need to be visiting a foot doctor regularly. If you're in our area, give us a call at Trinity Foot Center, where we help to keep Texans on their feet.